Okay, well, let's go ahead and get started. Thank you, everybody, for joining. Welcome. I am so excited to be here with everybody today as we kick off a new powerful webinar series called Nurses Leading the Way, The Path to COP30. I'm Grace Kistner. I'm a nurse. I'm a board member of SONCIEL, and I am an active member of ANNIE. And this event is the result of a meaningful relationship between both of our organizations, the Alliance of Nurses for Healthy Environments and the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders. Two organizations that are very deeply committed to supporting nurse-led action at the intersection of health, innovation, and environmental sustainability. Together, our organizations are launching a series of virtual events leading up to the United Nations Climate Change Conference, or COP30, which is happening this year in November in Belém, Brazil. These sessions are designed to inform and inspire and mobilize nurses all around the world because we know that climate change is one of the greatest health threats of our time, and nurses are uniquely positioned to lead this response. Over the coming months, we'll explore how the COP process works, how nurses and the broader health community have engaged in global climate advocacy, and how innovation on the ground across all corners of the world is reshaping healthcare for a greener and healthier future. Today's session, Green Growth Through Green Innovation, sets the stage for what's ahead, and we'll hear from nurses who are implementing local solutions with global impact, which showcases how our profession is driving real, scalable change. It's an honor to be in this space with all of you. And now I am delighted to pass the mic to my co-host for today and today's moderator, Kara Cook, who is the Deputy Director of Programs at ANNIE and a longtime leader in environmental health, nursing, and climate advocacy. Take it away, Kara.
Thank you so much, Grace. It has been great to partner with SONCIEL on this webinar series, and we can't wait for you to join us throughout the whole process. So we're just going to do a quick interactive portion. We want to hear where you all are joining from. So this is, you should be able to, actually, let me go ahead and, 1 second, apologize. Testing out my using Menti and Google Slides together. So apologies for that tech challenge. So you can join by going to menti.com and typing in this code, and you'll be asked to place a pin on the world map of where you are calling in from. And so I'll give folks just a few minutes to add in. If you have trouble accessing the Menti, please go ahead and drop it in the chat. And Grace, I'll kind of defer to you if there's any chat things that come up and I need to address them. Thank you. So we have some US folks. It's hard to see. I can't tell if that's US or a little bit of Canada there coming in. Some Europe, great. Very cool. So we got folks from different parts of the world, which is exciting because this is a international issue, and we'll have international perspectives on this. So great to see everyone. I'm gonna move us along to the next question, and this is the same Menti code. We'd love to see where folks, what's your practice setting? Where folks are mainly working. I'm sure you work in a few of these spaces, but what do you consider your main work setting? Oh, leadership management tech, very exciting. A little bit of everything. That's great to see. Awesome. Okay, and our last question here, just kind of a little pre-assessment to see where folks are, just kind of rating your awareness of climate change and health impacts, COP, or called the Conference of Parties, the United Nations Framework on Climate Change, Convention on Climate Change, excuse me, nurses at COP. Oh, we have definitely experts on climate and health, a little less familiarity with COP and nurses engagement at COP, which is, we like to see that because we will be going through all of that during this webinar series. I'll just give it another second for folks to enter. Awesome. Great, thank you so much. And we'll be kind of checking this after the webinar just to see if our content is helpful. So before we jump into the two speakers we have here, I do want to do just a really, really high level overview of kind of the United Nations climate negotiation process. On our May webinar, we're going to be delving a lot deeper into this. But this is just to kind of review some key terms that may be referred to in the first webinar and to give us a little bit of foundational knowledge as we build on this content over the coming series. So the first term is the United Nations Framework Convention on Climate Change, or what's often referred to as the UNFCCC. And so this was actually entered into force, so started functioning in 1994. And this is a convention that has been ratified by 198 parties, or these are parties to the convention, essentially states or countries that have ratified this convention. And what does the formation of this convention mean? Essentially, it recognizes that there is a problem relating to climate change, and the convention set a kind of lofty goal that the aim of the convention was really to stabilize greenhouse gas emissions concentrations to a level that would prevent dangerous human-induced interference with the climate system, and that it should be achieved within a sufficient time frame. The Conference of the Parties, which is probably the annual meeting, the COP that you've heard that's held throughout different parts of the world. This is the actual decision-making body of the convention. So all states that are parties to the convention are represented at the COP meeting, and they review implementation of the convention and make decisions necessary to promote effective implementation. As I mentioned, it meets every year, and there are two main kind of important roles that you often hear when you're talking about the COP process. One is the COP presidency, which is tasked with leading negotiations and coordinating activities during the COP process. The COP secretariat provides administrative, technical, and logistical support for the COP process, including organizing the conference and managing various expectations of the convention. And so I mentioned these because if you are ever interested in attending COP or following the process, you'll hear these two terms. And just last thing that I'm going to go over is because many of you probably all heard about the Paris Agreement, so I just want to touch on this very briefly. There's been many decisions over the years at various COPs, and I think perhaps the most significant has been the Paris Agreement. And this is a legally binding international treaty relating to climate change, and it was adopted in 2015 in Paris, of course, by 196 parties. The main components of this agreement is that it sets this overarching goal to hold the increase in global average temperature to well below 2 degrees Celsius, and some have even indicated pursuing efforts to limit to 1.5 degrees Celsius, and that's above pre-industrial levels. Another key item that came out of this agreement was that countries should develop and submit their nationally determined contributions every 5 years, and they should be building on each other. So each one that's submitted every 5 years has a higher level of ambition, and countries need to be reporting out on the progress in meeting those targets. And so that is it's very high level overview, but I encourage you to join in May to learn more about the process. And with that, I apologize. Let me go back to, that's not the slide I wanted. Here we go. Sorry. So I want to introduce our two speakers who are on our panel today. So our first speaker is Sarah Johnson, who is a nurse by background and owns and operates Tangled Carrot Farm in Florence, Montana, with her husband and children. Her small farm is dedicated to building soil health, conserving resources, and expanding local food options for her community. She values increasing the resilience of her bioregional food system and advocates for purchasing local and sustainable foods in her current role, leading environmental stewardship efforts in Providence St. Patrick Hospital in Missoula, Montana, located within the U.S. And then our second speaker is Imogen Stringer, who is a critical care registered nurse and currently in post as the new head of sustainability and specialty education and implementation manager at Great Ormond Street Hospital in NHS London. Prior to this role, Imogen was the Chief Sustainability Officer's clinical fellow working nationally with the Chief Nursing Office and Greener NHS team, working across a variety of different projects and programs of work relating to climate change and health. Her background in nursing and experiences from these roles mean Imogen is uniquely equipped to combine education, leadership, clinical nursing, and sustainable healthcare principles together. So with that, I'm going to stop sharing my slides and I will turn it over to Sarah to kick us off.
Hi, everyone. Bear with me while I pull up my slides. And, I looked at the rundown for this and saw that my introduction was very heavily focused on my farming efforts. And I just decided to leave it because my farm is where my heart is, even though today I'll talk about all of my work within healthcare. All right, let me know if you can see this. Are we good? Am I sharing? Fantastic. Okay. So as mentioned, I manage our environmental stewardship program here in Providence in Montana for Providence. Our hospital system spans across 7 different states. We have 52 hospitals. 10% of my time is spent working for our system program, and the rest of my time is working for our hospitals in the Montana region. So we have a goal to reduce as much carbon as possible from our hospital operations by 2030. This is supported. We just had some leadership change and it's continued to be supported, and a focus for our new CEO, Eric Wexler. And I just very briefly want to give you a level set of what our system looks like and what our environmental stewardship work looks like before I talk about actions that we're taking within the system. So we have 3 different pillars that are driving our work forward. The first is We Act, and it's our mitigation efforts, and we're doing a lot of data tracking in this area. We're tracking cost and usage and carbon for waste, energy and water, agriculture and food, chemicals and transportation for several different categories within each of those categories. We have our adaptation work, which is our We Reach pillar, and it stands for resiliency, equity, adaptation, climate, and health, and focuses on making sure that our communities, our buildings, and our staff are well equipped to manage climate impacts on health. And then our last pillar is advocacy, and that stands, I don't have what it stands for, so I'm not going to try to do it off the top of my head, but it's our advocacy platform and education, where we're aiming to advocate and educate from the local to the federal levels. And then we have key elements that are really essential for driving our work forward across our system, and that includes governance, mission and justice, leadership, finance and philanthropy, our Green Revolving Fund, accountability, compliance, and reporting, and communications. And then we have several different action groups all across our organization, from people that are working on facilities and engineering type of things versus food and nutrition services. So this is a very brief snapshot. I'm not going to go into detail. I'll send these slides to Kara if anyone has any interest in looking at them in depth after I present. But we have key objectives in each of our categories for waste, energy, agriculture, food, et cetera. And we have a 2019 baseline that allows us to look at how we're doing in each of those categories, and adapt and focus on find where opportunities are for continuing to drive our carbon emissions, our usage down throughout our facilities. So, we have this platform that's set up across our system to drive us towards carbon emissions reductions in our operations. And one of the things that I focus on is translating the heavy data portion into actionable items for nurses at all levels throughout our facilities. And so this slide here is adapted from the WAM grid, and it's actions nurses can take to address climate change. And so I just want to go over this before I talk about what we do. So on the left side is adaptation, and it's helping reduce the impacts of climate change. And it's a look at individual versus partnering with others or working with others. So individually, focusing on educating about climate change, being more prepared for frequent illnesses or more frequent people coming into your healthcare system when climate events occur, working with public health departments to create action plans, and supporting nurse scientists to research climate topics. And then on the mitigation side, helping reduce healthcare's contribution to climate change. There's individual actions within your healthcare organization to conserve energy and water through occupancy behaviors, supporting healthy food systems by choosing local low-impact foods or advocating for them within your healthcare facility, reducing waste by reducing consumption, choosing reusable products, that should say products, not projects, and recycle what you can, and advocating for climate-safe policies. And then mitigation, partnering with others, creating governance councils to address climate impacts on nursing, ask professional nursing organizations to advocate for healthy climate, encourage your workplace to conserve energy, encourage sustainable transportation and virtual meetings when possible, support environmentally preferred purchasing, and ask colleges and schools of nursing to include climate at all levels. It's a heavy slide. I read through the entire thing. I don't think I'll read through all the rest quite like that. So what does this look like when we're implementing it? Well, it looks like, we have councils at the system level, we have councils at the local level. And for me, I work with every single department and program manager in our hospital looking at what can they do? So facilities, they set goals, food and nutrition services set goals, and those goals look really differently. That still doesn't reach the clinical nurse often, that work, but our council does. And so we have some nurses that have focused really on doing those adaptation mitigation efforts at the bedside. Here's an example of one, our nurse Ildy White, who has, she's been part of reducing supply use, focusing on efficient supply use. One of our projects that we started working on together 7 years ago, and I can't believe it's 7 years ago, is just changing out metal spoons or plastic spoons for metal spoons in our nursing units. We looked at the data, we found that we're using over 70,000 plastic spoons per year, and this is one item. And so what we've been trying to do is focus, I'm going to skip to this example here. This is focusing, what can one person do? What can one person do when they make changes and actions in their work? And so we have this campaign that we've started, we're calling it the Power of One, and we're looking at different actions nurses take with different supplies, and we're calculating their impact. And so this one, it's one nurse, 624 patients per year on average. That's at least 1,248 medication passes on average. And this is based on an acute care nursing shift in my facility. So a nurse has a choice between 1,248 plastic medicine cups or 1,248 paper medicine cups. So they have a choice through, when there's the option for a more environmentally friendly option, they can choose that. And so other examples in this area include reusable basins versus disposable basins, isolation gowns, choosing a reusable washable isolation gown versus a single-use disposable plastic gown. And in our facility, we use over 35,000. And then, we want to make sure that nurses have the knowledge that they need, that they understand climate impacts on health and that they can act on it, and then make sure that that we're supporting them in those efforts. Here's another example of another nurse who's looking at, we have a council that we bring nurses to educate them on this, and then they go out into their work facilities, into their work areas, and they are the ones that are making the changes. Nurses have power to make change if they know what changes are available to make. So this nurse stocked metal utensils on her unit. She's one of the last, which is why I say this metal spoon project was 7 years. She's one of the last to adopt and change metal spoons out for plastic spoons. she focused on asking patient or nurses to choose paper cups for passes, using the metal basins for washing equipment, so many different things. The other thing that we try to do is make sure that we're supporting the waste streams, making sure that when we want people to use supplies efficiently to reduce their use of them, but we also want to make sure that they can recycle when it's possible, compost when it's possible. And so from a system level standpoint, we're working on setting those systems up so that people can make the right choice and it's easy for them to make that choice. The other thing that we've started doing to support that effort is that we've started tracking savings from caregiver action. You know, it's one thing to tell a nurse that they're like a spoon, our metal spoons to plastic spoon trial, that saves maybe $800 per year. It's not a huge savings, but the numbers really add up. However, other areas, there is significant cost savings. And so we're starting to track, what if we had a 1% improvement? What if we had like a 30% improvement? What does that look like for cost savings? And I don't know about the rest of you, but our financial bottom line is with so many changes in the United States, we're having funding cuts and things are getting a little tighter. And so making the right choice financially and environmentally has become extremely important. And I just have a couple of more things that I want to touch on. So service, health, advocacy, relationships, and education, that's what We Share stands for. We want to make sure that our nursing staff have the education that they need and have opportunities to get engaged with our programs, both within our healthcare system and then within our community. And so we do a lot of partnerships. We partner with a local organization to do a river cleanup, and we talk about why it's important to take care of our waterways. And so we use it as a pathway for educating about the broader planetary health connections. We do guest lectures for local community or local colleges, nursing colleges. Last year or 2 years ago, we planted trees, which falls into both our We Share and our ReReach category. We looked at a tree equity score for around our hospital, looked at where there was low canopy cover, and we planted trees in those areas within walking distance from our hospital to help improve the resilience of our local communities with trees offering. And then we use it as an opportunity to educate about why trees are beneficial in urban environments. And then we sent out monthly newsletters. And, you know, it used to be just me doing this, newsletters, sending out newsletters and educating. But now with a council that's been meeting for several years on this topic, I found it really valuable to help our council members feel comfortable and confident in taking on the work of educating. And so supporting them to use like the Nurses Climate Challenge and become comfortable with using that and talking with others about it. And our We Reach platform, our pillar in this work, this is new for us. We started resiliency work about a year ago at our system. However, I live in a community locally that is pretty advanced in this area looking at climate resiliency. We have something called Climate Ready Missoula, and they're working on several different aspects of what impacts does climate have on our community and what should we be doing as a community to adapt to this. And so we've been partnering with them, looking at what can we do to send out education across all sectors. How can we partner with our other health facilities within our community to make sure that we're working together? So if and when climate events happen, we are taking a united approach and trying to make sure we're taking care of our most vulnerable populations. We're doing this at a system level as well. Every single facility within our system is looking at the climate impacts on health in their region, and they're developing plans as well. They just, different areas of our Providence system have less opportunity to partner, or different opportunities for partnering with their communities based on the work that's already happening there. And with that, I will pass it on to Imogene. Thanks.
Thank you so much. I will just also share my screen. Bear with me. I am hoping that is now appearing. Lovely. Fabulous. Sorry, I got a couple of screens up, so I couldn't work out which one. Thank you all so much for having me here today. I thought I would start to just give you a little bit of a background as to, I know Cara kindly introduced me at the beginning, but a little bit of a background of where my career to date has been as a nurse, and then go into some of what it looks like within NHS England and what I'm doing specifically at my area of work within Great Ormond Street in London. So I am currently the head of education for sustainability, and I also lead on the Born Green Generation implementation manager, which is part of the Healthcare Without Harm Europe's project, where Great Ormond Street is the paediatric pilot site. A little bit of background about me: I'm a registered nurse, spending predominantly most of my time in critical care, and then moving into critical care clinical education. Where I then stepped into a secondment role as one of the Chief Sustainability Officer's clinical fellows within NHS England, where I then worked a little bit longer with the Chief Nursing Office, and then stepped into my role at Great Ormond Street, which has been a really nice role to sort of amalgamate all the different sort of backgrounds that I've had in my career so far. I won't go into this too much detail because I'm imagining most of the people on the call have probably got a good understanding of why climate and health where the intersect lies, but certainly from an NHS, National Health Service perspective within England, the NHS was created to deliver high quality care for now and for all future generations. And we know that climate change is, we're effectively creating our own patients and putting increasing pressure on the system. So we know that we need to respond. And NHS England responded to these impacts of climate change and health by stating that the climate emergency is a health emergency, and we know that it threatens the foundations of good health, and therefore our patients, public, and the NHS as a system as a whole. So a bit of a background, because I know we've got people internationally on the call. I thought I'd give a bit of a background as to what NHS within England, what it actually looks like. So it's a publicly funded through taxation, so it's free at the point of use. It employs over 1.4 million staff, so it's Europe's largest employer, and actually one of the 5th largest employers across the world. It includes 229 healthcare providers, which we call trusts. So Great Ormond Street is a trust, and almost 7,000 GP practices, seeing over almost 1.3 million people a day. So it's, although there's been some very recent changes to how this now looks, but it is generally managed through one national team, which is then divided into 7 different regional teams. And then within that, we have 42 what we call integrated care systems, which the trusts then sit within. So back in 2020, in October 2020, the National Health Service in England actually became the first world's health system to commit to reaching net zero. And they set some quite ambitious targets to reach net zero. So we've got some targets for 2040 for the emissions we directly control, and then some targets for 2045 for the emissions that we can influence. And as a part of that, it's within our Health and Care Act from 2020, and it's one of the first health systems to actually embed net zero into our legislation. So all of our healthcare professionals are mandated to be acting and striving towards net zero. And resultantly, it means that all of those 229 trusts that I sort of highlighted within NHS have to have their own green plan, so a strategy as to how they're going to get towards net zero. And we have a regulatory body called the Care Quality Commission, where they have recently actually included regulation around environmental sustainability. So under the well-led framework, so when they're auditing all of these areas, they will be looking at what we're doing to meet our environmental sustainability goals. So there's been a lot of progress in the last few years as to how we can actually get that transition into healthcare and how healthcare can contribute to the climate crisis. And there's been a lot of work to do with where our carbon footprint lies, which I'm sure probably isn't news to you. But I always think that these diagrams are quite helpful just to really help differentiate where our influence as nurses lies, especially in the scope 3, those indirect bits. I feel as clinicians, we've got a lot of scope to be addressing some of these in particular with the medicines, medical equipments, and other supply chain areas. So I thought I'd give you some examples of what I've been doing at GOSH. So at Great Ormond Street, we have divided. It's always difficult to know how sustainability is so broad, and there's so many different ways that we can act, and it's really easy to get a bit stuck of what are the first steps. And I know everybody sort of maybe divides those buckets of carbon in different ways, and it's very easy to do. But at Great Ormond Street, we've divided those buckets of carbon for us to focus on across 10 different programs of work. So we're looking at procurement and circular economy, our travel and transport, food and nutrition, our people, sustainable care pathways, medicines, digital transformation, our estates and facilities, which we call space and place, community realm, and adaptation. So some examples of what that looks like, which I'll go to some of these into a bit more detail. But initially, the first step for Great Ormond Street was that we just did our own carbon footprint to get a real understanding of, we know what it looks like nationally, but what does it look like specifically for a paediatric hospital such as Great Ormond Street in the centre of London, which was really helpful to see and set our own targets to sort of inform our green plan. And then some of the other highlights are we've had a complete phase out of the anaesthetic gas desflurane at Gosh, which has also been a target that's been pushed nationally too. So I think we've actually got a complete phase out of desflurane across the UK now. And we're also now on mapping of how we can reduce our nitrous oxide on site, which has been very successful in the last few years. We do a lot for our travel and transport. So we've got a growing electronic fleet for our ambulance services. And also we have been recognised with a gold award for our safe and active sustainable travel. So we have lots of different sort of activities to support staff to be able to actively travel to their place of work. So a lot of bike schemes, we've got a doctor bike service, people can get their bike service for free, initiatives like that. But also, as we're talking about COP back in 2026, when COP was hosted in Glasgow, we had a thing called Ride for Their Lives, which was leading climate advocacy in paediatric health. So we had a team of people, which you can see in the middle of that slide, who cycled with a lot of our children and young people from London all the way to Glasgow. And then other elements, which I'm going to go into a bit more detail shortly, would be, we also have some initiatives such as Play Street, where we actually close the road outside of the hospital, which is normally quite congested with ambulances and things like that, and we make it into a play area to try and help bring children outside of the hospital into the outside world. And we've got a new cancer centre being built, and there's a lot of work being done there to increase our biodiversity and sort of bring the inside out of the hospital, which is a really unique and quite exciting experience there. But one of the things I wanted to highlight of what I'm working on for part of my role is the Born Green Generation project, which was, as I mentioned at the beginning, is funded by the Healthcare Without Harm Europe team, which is where we deliver toxic-free and reducing plastics in healthcare. And it's mainly focusing on the first 1,000 days of a child life, reducing that exposure. And it's really sort of focusing from that cultural shift within all clinical staff, but predominantly our nursing staff, from disposability into sustainability. It's aiming to look at the direct exposures of microplastics and toxins, but we're looking at the wider impacts too. And we're a pilot site, and the aim of it is to be sort of sharing and scaling and spreading some of these initiatives to sort of build resilience and transparency in some of our supply chains, but also improve the sort of health and well-being of children in the future. What that looks like is either innovating practice, shifting cultures, and then aiming to then transform policy. So far we've been looking at a variety of different things, but I think some of the highlights are, one of the things we're currently implementing is changing some of our medical equipment, which has been predominantly disposable, into reusable, such as SATs, oximetry probes. We've done some pilot testings of just making a pure swap of trying to provide more reusable probes, that people have the choice and decision to either choose a disposable or reusable for their patient. And we even just with a 25% reduction of what we've seen so far of our disposable probes, it's a huge cost saving of over £57,000 for the trust a year, and it saves over a quarter of a ton of plastic going into general landfill. So it seems like quite a small swap, but even just with a small reduction of 25%, we've actually seen some really big cost savings and plastic savings. We're also looking at some of our textiles, which is kind of similar to some of the initiatives that Sarah was describing, but we're looking at some of our textiles, especially in our operating theatres. So we've moved away from our single-use products, such as gowns, hats and curtains, and even surgical drapes, which we're now using a reusable format. And there's been quite a lot, a huge part of my job, I think, is to really embed education, sort of empower clinical staff to be able to see the opportunities and leadership within sustainability, but also help provide them practical tools. So we're currently running a program within our hospital, which is like a Green Champion team competition, which is really going to be, which is each team, so they're clinical and non-clinical, pick up a sustainability quality improvement project, which has the aim of, although it'll have triple bottom line outcomes, but it has to have a focus of either microplastic or carbon reduction as one of the primary outcomes. And we're putting them through giving them protected time, which I know is quite a luxury within healthcare settings, but giving protected time to actually focus on these projects and provide a workshop and coaching mechanism to actually go through those quality improvement cycles, carbon footprinting and data analysis, so that more and more staff that might have a passion or an idea, but maybe don't have the protected time to be able to actually act on that. So hopefully embedding some of those cultures into practice so it can be carried out and expanded even after the project sort of timeline's finished. And we ran a similar project last year, and we actually had, I think it's a shame to be talking about finances, but it's the world we're living in at the moment. We actually managed, across the 6 teams that entered, we managed to save £250,000 worth from just those projects that those teams had done, with over 90,000 kilograms of carbon alongside it too. So some really quite impactful projects that people were able to implement. And I guess one that came slightly before the Born Green project, but we're certainly continuing with the campaign, is our Gloves Are Off campaign, which certainly the outcomes aren't just significant to the reduction of plastic, because we found that even just with providing some education of the appropriate use of glove use within healthcare settings, we actually had a reduction of 21 tons of gloves, which is over 96,000 kilograms of CO2, but also a huge financial saving of £90,000. But also we found that there was improved hand hygiene compliance, and it reduced the level of dermatitis in staff. So we actually had, in the longer term outputs, there was less staff going off sick or requiring occupational sort of health support with those sort of dermatitis due to the overuse of gloves. And there was no significant changes to healthcare associated infections. So I always really like this Gloves Off campaign as a really nice sort of case study to show that anybody can kind of get involved in these projects. And even though it feels like it might be a small change of, if I'm a nurse on the ward, making one small change by using my gloves appropriately, the impacts are actually really quite large when it all adds up together. And a similar case study, I know I've been talking quite a lot now already, so I'll try and wrap it up, but another case study on a similar conjunction to the Gloves Off is we did a similar one for Cut the Cannula project. So it was actually looking at, in a A&E perspective, like how many of our patients are cannulated and how many are then unused. And we found that 37% of cannulas remained unused, and patients had a negative view on that. They're obviously painful sometimes and they would rather not have one. So it was just going through a census check of, how much are we doing here out of habit, who actually needs to be cannulated, and going forward. And the aim was to reduce that cannulation by 20%, which, as you can see on the slide, had some a huge financial saving again of £95,000, but also some carbon saving and improved patient satisfaction. And also led to less patients then being given IV medication instead of oral when they could have happily taken oral, or it was suitable for them to take an oral medication. But because the cannula had already been cited, IV was just kind of like the default option. So it was really good at looking at some of the different clinical decisions we make, and then what influences our decision to be able to make more sustainable changes to our practice. I think this is one of my last case studies, but it's just we're doing a fair bit for food and nutrition as well at Great Ormond Street, and we became a member of the Cool Food Pledge, where we're looking at where our total emissions sit with the food that we provide, either in the canteen but also to our patients on the wards. So we've been doing a lot to look at our provision of healthier, more locally sourced and seasonal menus, and trying to promote plant-rich menus, which are actually created by our children and young people at Great Ormond Street, to sort of really embed some of those behavioural changes and the want to choose the plant-rich option as opposed to potentially the red meat option. Yeah, so I think the main bit that I wanted to kind of then say is that it's quite exciting, my role in itself. I just really wanted to showcase that. So it's one of the first, being a head of education for sustainability is one of the first of its kind to actually have somebody dedicated to be looking at the education that we're providing to our healthcare staff. And it really allows that focus on engagement and that building of capacity and capability among our staff, and actually create opportunities for nursing. And some of the initiatives I've done, I've been able to create some sort of hybrid roles. So we're actually allowing nurses to step out of some of their clinical roles for a small part of their working week to be able to focus on sustainability and local initiatives, either for their ward department or the trust itself. And I think it's so important to remember that nurses have such a broad influence when it comes to addressing climate change. And gosh, I think we're really starting to see some of the impact, the work that our nursing teams can have. And I think, yeah, it's just really important to keep shouting about what we do. I think nurses, we're very humble about what we do. And I think there's platforms like this which really show and give opportunity for us to sort of showcase what the incredible influence and impact that nurses can have in this space. So I think my sort of takeaways from what I've learned within my role at Great Ormond Street and connecting with all of you here today, but I think the main thing is what I would say to your nursing colleagues is to be able to, if you can, is give people permission to run at it. We've got such a huge nursing workforce, but I think some people don't always realise that it is our responsibility or the influence and impact that we can have. So give your colleagues permission and help if you can build any capacity and capability. But I think the main bit is to be able to have some fun with it. So much of the problems that sometimes we come up against is being able to unlock the passion of the nurses that we have. And if we can all come together and have some fun with it, we know that we're probably going to be successful if there's also going to be fun involved in that. And I think some of the initiatives we've been doing at Great Ormond Street are good showcases of that element of we're striving towards some really ambitious targets, but we're also having some fun with it and involving our patients and children and young people in with it. So yeah, I think my main message is things don't come when just one person tries something. It's when one nursing department or when we all run at it together. So it's been absolutely lovely to connect with you all today. And I think that is me finally done. Sorry for over talking there a little bit. I think I've gone over time, but if there's any questions, more than happy.
Thank you both. And we are actually right on time, so that's perfect. Thank you, Imogen and Sarah, for your presentations. We do have some time for questions. I'm sure folks have questions. And we have a small group. So if someone wants to come off mute, feel free, or we can just answer questions in the chat. So feel free. I'm just trying to see if we have anything in the chat right now. Oh, thank you, Grace, for popping stuff in. Any questions? I know both health systems that Imogen and Sarah are affiliated with, I would say, are leaders in the area of healthcare sustainability. So these examples are great initiatives to be able to replicate. And I think there's a lot of data and support for the programs and the outcomes that are achieved. I think while we're waiting for folks to ask questions, and if anyone wants to come off mute, feel free to raise your hand or just jump in. But I'll just ask a question to kind of draw the connection between these healthcare sustainability initiatives and the United Nations climate change negotiations. I know both of your health systems have had representation at COP in past years. Imogen, you were actually there last year, presenting on some of the work that you were doing. And so I think that my question really is, so how does that kind of localize their national healthcare sustainability efforts translate into what's happening at this global scale in terms of the climate change negotiations?
Okay, good morning, everyone. I do not have a question, but I would like to share a little bit of my experience. I am from the Eastern Caribbean, island of St. Vincent and the Grenadines, but I'm currently working in Jamaica. Now, the Caribbean islands, even if they're all put together, do not have the type of emissions of the developed and industrial world. However, we experience, I think, the greatest impact. We just had recently the passage of Hurricane Beryl, and my country, St. Vincent and the Grenadines, was devastated. One of the Grenadine islands was practically wiped out. Thank God there were probably only 8 or so loss of lives, but buildings were flattened. It impacted nurses because they had to find some place to deliver care. The nurses were themselves impacted because their resources, their homes was destroyed, but notwithstanding that, the nature of what we do, they had to get right in, assist with the recovery process, delivery care, assisting sorting out the mental health of the people who are, or the community. Well, there's an entire island assisting in sorting out their mental health, work with a multidisciplinary team, including persons from the UN, etc. But we keep getting these promises, meeting after meeting, UN Convention, climate change mitigation, vulnerability. We keep receiving all these promises, but we are not seeing any tangible outcome. It is not trickling down to us. The promises are not made. And I recall not so long ago, the Prime Minister of Barbados, Mia Mottley, alluded to it. There is no recourse, if that is an appropriate word. What we do not think that enough is being done to provide this sort of buffer. We cannot do anything about the climate change, but there is nothing or enough is not being done to provide a buffer to protect these vulnerable population. As a nurse, we can only, well, we can do some mitigation and preparation, but the climate events wipes it all out. It just wipes it all out and we become helpless. And then you find us now in a situation where we are dealing with the aftermath of climate change. We are dealing with the aftermath of the unavailability of food because crops were wiped out. We have to deal with parents to prevent malnutrition because of food shortages. We have to deal with the issue of increased food prices because of the shortage. So nurses are in the mix of it. And I'm happy for this series and I would like if I can attend it all because it just hits home. It just hits home personally and professionally. Thank you.
Yeah, thank you, Dr. Gittens, for sharing that. Your comments, I think, hit on multiple issues that Annie Alliance of Nurses for Healthy Environments as an organization advocates for. And I think this is why we need more nurses in this space, because one, those healthcare stories aren't being heard enough in the healthcare impacts mitigation, but also the damage that's already been done in the preparation needed. That's not being heard by the people who are making the decisions. And then I think that, you know, that bigger piece around getting funds committed and dispersed to countries that will need to that already need to be either, you know, adapting to climate change impacts. We've seen over the past years, and even with the most recent COP, the real lack of ambition to allocate those funds. We put out a statement once we heard the outcome in Azerbaijan COP29 of how very little developed countries committed to providing to developing countries for loss and damage and adaptation, because it's a tiny amount compared to what is needed to help countries prepare. So I thank you for your comments, Dr. Gittens. I do hope you can join, because I think your perspective is so important for other nurses to hear, but also for beyond this group to hear. And I think it's a piece that we can think about as nurses, is how are we entering into those spaces where we can make our voices heard and be in kind of positions of influence. So thank you. And I didn't mean to take up the time to answer questions. I don't know if Imogen and Sarah have any comments either.
Yeah, no, I was going to say thank you so much for sharing your sort of perspective there, because I think, yeah, I think that, as I think Kara's kind of really beautifully articulated, I think it's so important that we know that nurses in particular, we witness firsthand how climate change disproportionately affects vulnerable populations, however that might look in different countries. And I think it's just really important to know that, because we've got that sort of breadth within our role and professional skill set, that it's so important for us to be able to take those perspectives to places like COP to actually help make sure that the goals that are being set around climate justice and health equity are actually matching what we're seeing. And I think nurses have that really unique position in healthcare to actually probably provide one of the best perspectives there is there from such a diverse sort of breadth there. But yeah, no, I completely agree. I was going to try and go back to your original sort of question there, Kara, but I think the main bit is just, I think, to get nursing at the table. The healthcare sort of community has been growing at COP in the last 5-10 years, amazingly so, but nursing is still slightly underrepresented. It's mainly our medical colleagues. Yeah, I think as nurses, we're such great advocates and educators, and also really good problem solution finders, that we have such a huge ability to be able to sort of show some of our scale and spread of the initiatives that we might have come up in our local area or country, and spread those, but also how we can influence some of the policy making and the negotiators, because we do just have that breadth there. I think that's my main comments there. Sorry, I don't know if you wanted to come in there, Sarah.
Yeah, happy to comment as well. Thank you all for your comments, and Dr. Gittens for sharing your story. I think the thing that struck me while you were talking, Dr. Gittens, is that we're living through these climate events. We're in the communities where they're happening. I myself was evacuated from my home while 37 weeks pregnant due to a wildfire, and several of my colleagues were also evacuated, and we were still showing up to school, or not school, we're still showing up to work. Our kids still had to go to school. And so we're living through these events as part of the communities where we're working within. And so that need for education for all of us, for us to understand the issue, we already understand it, but to be able to be empowered to use our voices, and because we are at so many different levels, working directly with people in our communities, and also working at different levels of leadership throughout our communities and beyond, empowering us to bring that voice to the table. I think that's that, along with building resilience in our local communities. Why is this work so important in our communities? Because we are everywhere, and when we have stronger, resilient communities, you talked about food shortages, Dr. Gittens, which is like near and dear to my heart as a farmer by background, and so my work to build food resiliency in the face of climate change. You know, when we are building strength in our local systems and redundancy in our supply chains, whether it's food or medications, etc., when we're bringing it down so that there's more redundancy, we have more resiliency across the board. And I think it is important to bring that voice and our experiences to COP to share that as well. Thank you.
And I think we have time for one more question or comment if anyone wants to come in. Yeah, I think that so, and Dr. Gittin just added into the chat, can we have a global coalition of nurses to address climate change and its impact on health and nursing? And I think that's something that the Alliance of Nurses for Healthy Environments is looking to do, as well as we have, colleagues, nursing organizations in other countries who are working on the issue. We've also been collaborating with the International Council of Nurses, and I know they've taken some positions on climate change and health and done a little bit of work around that. But I think that's something that we're interested in thinking about how, we can kind of form that a global coalition like that. And I that's one of our aims too for this series, is to really kind of see where the interest lies in terms of nursing, learning more about the COP process, but beyond the COP process, and how can we work to empower nurses to step into those roles. And so, yes, I think that is something we are very interested in. So thank you for that comment. I'm just going to go ahead and wrap us up here. I thank you everyone for your participation, and thank you to our speakers. I'm going to go ahead and just do, like I mentioned in the beginning, we were going to do a little bit of a post test. So if you can all just join us in the Menti here, we have a couple of just quick trying to get your input on. So this is just a post kind of assessment to see how your awareness might have changed on these topics. So I'll give folks a minute to answer. Okay, so a little bit more. So that's great to see. I imagine this will grow quite a bit over our series. So thank you, everyone. I'm going to go to the next slide. So one of the things that we are looking to do with this is not just have this be education. Of course, we want everyone's awareness to increase, but also to think about the ways that we can, as nurses, can take action, whether that be in actually attending COP or some of these influential meetings, and also what we can do, virtually or in our own communities. And so what we are looking to do is have a visibility campaign in which we will later on in the series, we'll ask nurses to kind of share via social media, and we want you all to help us pick the hashtags. I see folks already voting. This is great. There wasn't an option for me to do like an other or add in. So if you don't like either of these and you have another one that you think we should consider, please feel free to enter that into the chat. Because we want to be able to get your perspective as we're kind of building out this campaign. And then the last thing, we just want to get your feedback. We have a rough idea of what we'd like to share throughout this series. And again, the series is gonna run from now until the lead up into COP in November, with a short break in August. But we're curious to hear if there's any topics you would like us to incorporate within the series, anything you'd like to learn more about, so that we can make sure that we are meeting the needs of you all participating. And as a reminder too, for folks, if you can't join the sessions live, we are recording and we will be posting these on our learning site so that you will be able to access after the fact. And we'll also share the recording with everyone who registers. So I'll just give everyone another minute, and while people are adding in your thoughts, I'm just gonna tease the oh, perfect. Yes. I'm going to tease the webinar for May, so that hopefully you all can join us. It'll be held on May 21st at noon. We're going to delve deeper, like I said, into the COP, a little bit more about the technical pieces of it. And then we're going to hear from nurses who have attended a COP in the past to share more about their experiences, and what they kind of their experiences and also what they would like to see differently, or where they think there is some opportunities for nurses to fill within those spaces. So there is a QR code, which will take you to the link to register for that May webinar. So we hope we can join us in May, and I thank you all for joining us, and I hope to see you in May. And if you have any questions, I'm going to pop my email in the chat. Please feel free to reach out to me. And if you were still working on adding to the Menti, please do add your thoughts and ideas around what we should talk about within the series. So thank you everyone for joining.
Thanks, everyone. Thank you, Imogen and Sarah.
Thank you.